Hi, everyone. Thanks for joining us. I'm Eva Bodkin-Kowacki, a science reporter for News at Northeastern. We're live today speaking with Dr. David Madigan, Provost and Senior Vice President for Academic Affairs at Northeastern. David is also a healthcare statistician. Among his many distinctions, David is one of the leaders of the Observational Health Data Sciences and Informatics program. That program is composed of researchers around the world who harness the power of big data to study the safety and efficacy of healthcare practices. Welcome, David. Thank you for joining us.
Hello. Happy to be here.
Hello from the other side of our Boston campus. For our viewers, David and I are unmasked because we are alone in separate rooms.
Yep.
David, we've asked you here to help us make sense of COVID-19 data. Across the country and the world, we've seen COVID-19 cases go up again due to the Delta variant. And the headlines have been, well, kind of panic-inducing about both rising case numbers and breakthrough cases in which fully vaccinated people test positive for COVID-19. So, David, now that everyone in our community here at Northeastern is required to be vaccinated, how concerned should we be about rising case numbers and breakthrough cases?
Well, we should certainly be concerned and be paying attention, but we're in a very different situation than the one we were in, let's say, this time last year. We are now in a mode of living with COVID rather than trying to hide, if you will, and or hibernate. The mode we're in now is because thanks to vaccines, thanks to the miraculous vaccines, we are in a different mode. So for vaccinated people, the risk of serious illness, or death, is very low. It's very dramatically smaller than it is for unvaccinated people. So vaccinations are the key. Getting shots in people's arms is what matters. And as you said, we have a fully vaccinated community here at Northeastern. So it's not that COVID, even for a vaccinated person, you don't want to get COVID, right? It's going to make you sick. It's going to make you feel rotten for a while, possibly. But the good news, so you don't want that, and it's worth taking some measures to avoid that. That's why we're all wearing masks when we're anywhere around other people. It's also why we're testing the community here on a weekly basis. And so this is not something to be desired, but the morbidity and mortality burden associated with COVID is dramatically reduced with the vaccine. So it's more like a nasty flu is going around out there. You don't want to get it. You want to avoid getting it, but we can't put our lives on hold. It's not appropriate to suspend our lives, to suspend normal operations of the world, because of this. So it's a new normal, and it's really our mindset should be living with COVID, not hiding from COVID.
Mm-hmm. So for vaccinated people, we're seeing these case numbers go up, and that can kind of produce a bit of anxiety for folks thinking about how we were a year ago. Are case numbers still the best metric for monitoring COVID-19 for those of us who are vaccinated? Now that we have vaccines, which metric is important to pay attention to? And can you tell us a little bit about why?
Sure. So, last year, this time last year and throughout the academic year, we were indeed, obsessed with numbers of cases. And that's what we, here at Northeastern focused on, intensely throughout the year. It isn't really the appropriate metric anymore. Just like we don't obsess over flu numbers, what we worry about is serious cases. We worry about, hospitalizations, and in rare cases, death. And that's what we now need to focus on, and what we are focusing on now. And the good news is, despite the rising numbers, of the Delta variant and these breakthrough cases, we are not seeing an equivalent rise in serious illness, hospitalization, as measured by hospitalizations and death. That's not to say that those numbers are zero. There are risks associated with COVID, even to a vaccinated person. It's just that those risks are very low. So we live with risk in our lives. You step out onto the street and there are risks. There are risks of cars running amok or lightning might strike you. Life is full of risks. The question is a particular risk high enough that you completely alter the way you live? And that's the mode we were in last year. That is not the mode we're in now.
Okay, so I want to ask a little bit more about this kind of risk calculation that we're doing constantly. So is there a sense when we're watching the trends that we should be keeping an eye on longer term trends, because some of these metrics, the hospitalizations, death rates, could be going up, or should we be concerned by spikes in the same way that we can be at times?
I think both. So there's a group of epidemiologists and statisticians and public health experts here at the university. We're watching all kinds of things all the time. We're paying a lot of attention to countries like Israel and the UK, to get a sense of exactly what is the story. After a peak in what is now mostly the Delta variant, what the hospitalization and death is certainly a lagging indicator, but we can see from other countries who are in some sense ahead of us in some of these waves. You can see what's happening, and the good news is, take Israel as a case in point. Infection rates have gone back up in Israel. It's not a surprise that there will be breakthrough cases. The vaccines we know the vaccine efficacy is not 100%, so there are going to be breakthrough cases. But what we're not seeing is a rise in rates of hospitalization and death that are anything like they were at the peak of the epidemic. Another issue that might be worth bringing in at this point as well is there's a lot of debate out there, heated debate about waning vaccine efficacy. I mentioned the Israel study, which is or the Israel context, which has attracted a lot of attention. And in that context, it did seem like as if the efficacy of the vaccines did seem to be waning. However, if you look closely at the data, efficacy with respect to hospitalization and death has not waned so far. It has not waned. So there are many possible reasons why you can see that there might, it's possible that the increased number of infections that we're seeing amongst vaccinated people in Israel is an artifact of differences between people who were vaccinated early in the year and late in the year. We just don't know, but it's very reassuring that the vaccine efficacy with respect to hospitalization and death is very much holding up. For now, we know that inevitably we are going to need booster shots, but there's a heck of a difference between needing a booster shot once a year, versus needing a booster shot like tetanus, every 10 years. And right now, we simply don't know. That will become clearer in the coming months as to when we're going to need booster shots. But what's been lost a bit in the headlines is there's and happily it's a lovely thing that the efficacy with respect to hospitalization and death is holding up extremely well.
So it really is what you were talking about earlier about this metric. Case numbers aren't really what we should be watching anymore. It's hospitalizations and right. Death. Okay.
Yeah.
So is there kind of a sense of a threshold of while we're watching these metrics of how we can tell if things are going well or going poorly? What in the data indicates when I should or shouldn't worry about COVID-19 in the community?
Well, it is hospitalization and death is what we should all be focusing on. I should say that everything I'm saying here, and we're all saying, is contingent. It's contingent on the state of public health being, and this was true throughout last year, and all the decisions the university took about keeping classes going and keeping the campus open and so on. It was all contingent on the state of public health. So right now, the state of public health is such that there's been a sharp increase in the number of cases, but not a corresponding increase in hospitalizations and death. That may change, and it could be that a new variant emerges. I think there's some evidence that Delta has peaked, and certainly has peaked in some states in the United States. That may be the case, but the future is still uncertain. Like, we do not know what other variants may emerge in the coming months, and that may be that the vaccines might not be so effective against. So right now, it's my belief, it's our belief, that it is appropriate to approach this as living with COVID. Take reasonable precautions, wear masks, get vaccinated certainly, but proceed with our lives. But that could change. We hope it doesn't, of course, but that could change in the coming months. And we're watching. As I said, there's a team watching this very carefully. And that team is ready to pivot if we need to relax rules, like hopefully we can relax the mask mandate in soon, we all hope, but equally we could go the other way. So if needs be, we will take actions that are more restrictive, depending on how the public health situation evolves in the coming weeks and months.
Right. So let's talk a little bit about the precautions that can be taken here, and that we are taking here at Northeastern. Let's talk a little bit about testing first. You mentioned that we're doing weekly testing. Why are we testing people once a week? Last year we were testing multiple times a week. What's changed?
So what's changed is our vaccines. We're dealing with a completely different situation here. We're dealing with a virus, as we talked about, that can give you a nasty dose that you don't want to get. You don't want to have fever and flu-like symptoms for a few days. You want to avoid that, but it's highly unlikely to make you seriously ill. So a completely different situation. Last year, we had detailed epidemiological models that suggested that testing every 3 or 4 days, we settled on every 3 days in the end, or every 4 days, in the end. Our models suggested that would be enough to basically avoid serious outbreaks on campus. In a sense, it got inside the virus cycle. And the reason for testing last year was to remove people who were positive, so thereby preventing them from infecting others. That was to break the cycle. That was the whole point of testing. This year it's a little different. So we're testing it, sure, in part. If somebody tests positive, we will either have them isolated on campus in wellness housing or ask them to isolate in their off-campus setting. And that will help prevent further spread. But that is no longer the primary objective. The primary objective of our testing this year is knowledge. We want to know how prevalent is the virus in our campus community, and perhaps even more importantly, we want to know about what variants are out there. So we are, for every positive case, we will be checking to see which of the variants it is. We'll also be doing sequencing so that we will know if new variants are emerging, and we will be looking for as variants emerge around the country and around the world, we will be adding those to our battery that we're looking for. So the purpose is different. We are in a different place. It's not all about removing infected people from our midst. There's a piece of that, but it's much more about knowledge. We want to know what's going on. Why do we want to know what's going on? So that if needs be, we can pivot.
Mm-hmm. Okay. So one thing that, you brought up that last year, the strategy was to stop the spread. The idea was to remove people. So for those of us who are vaccinated, which is our entire community now, how contagious could we be if we test positive versus someone who's unvaccinated, the situation we were in last year?
So yeah, it's become clear, and just in the last few weeks or couple of months, that vaccinated people who become infected, they might or might not be symptomatic, and it's clear that many people are asymptomatic. It has become clear that yes, you can be you're vaccinated, you become infectious, you may be contagious. What we now know is that you're likely to be contagious for a shorter period than an unvaccinated person, like about half the duration, but for about a period of time that's about half the duration of an unvaccinated person that you're infectious. The evidence also suggests that you're probably slightly less infectious than an unvaccinated person, and it's the viral loads are similar between infected vaccinated people and infected unvaccinated people, but it turns out that even though the viral load is similar, you're probably slightly less infectious. So you're slightly less infectious for a shorter period of time, but you can be infectious. So we certainly want to take precautions. Just it's common sense. If someone is positive, we would like them to be to step away from our community until the point when they're not infectious.
Can you clarify what you mean by viral load and why that matters in this context?
So viral load is I'm not a virologist or I'm a statistician, but as I understand it, it's a measure basically of the amount of virus in your body, in your system, and it's it is highly correlated with infectiousness. So the higher the viral load in general, the more infectious you are. But this is where it gets beyond my knowledge. As I understand it, a given virus, a given SARS-CoV-2 virus can be more infectious or less infectious, and vaccinated people, their viruses are somewhat less infectious than unvaccinated people.
Mm-hmm. Okay, thank you. So you brought up masks as another precaution that we are taking, and we here in Boston are required to wear masks, so it's not really a decision we have to be making right now. But can you talk a little bit about what a mask does and kind of why we might be thinking about masks in terms of how the virus is transmitted?
Yeah, so masks. I mean, nobody likes wearing a mask. It's a nuisance, but it's not that big a deal in terms of it doesn't stop us from getting on with our lives. So as a precaution, you don't want to do it, but it's not that big a deal, right? So it seems to me it's a completely sensible decision to require masks indoors. We know that this virus is spread mostly through, it's aerosolized, so it's small particles in the air. Masks are extremely effective at preventing the spread. So is good ventilation. So in addition to wearing masks to reduce the possibility of spread, we should, insofar as possible, keep our windows open. We should do as many things outside as we possibly can. So say this isn't last year. This was truly a matter of life or death, right? This year it's not. It's just there's a nasty virus running around out there. You don't want to catch it. Take reasonable precautions, and
Right.
reasonable precautions include wearing a mask and keeping the windows open and doing things outside. These are kind of just sensible things to do to avoid getting something you don't want to get.
Absolutely. So I have to ask. We were talking about breakthrough infections and learning to live with COVID, and you mentioned that breakthrough infections, it could be nasty as a flu, but you're unlikely to go be in the hospital, and it's unlikely to be severe. So, I have to ask, in terms of masks, if we're stipulating that at least in vaccinated people, COVID-19 could be becoming more like a regular flu or cold, or even an asymptomatic positive. Before COVID-19, we weren't wearing masks to prevent the flu or colds. Do you see an end to wearing masks, or do you think they're kind of forever part of our lives now?
I don't know. I mean, in East Asia, mask wearing became, after earlier epidemics, mask wearing, mask wearing became very common. Um, I, you know, I think it all depends. I think it's likely that this virus is going to be with us for quite some time. It may, it may be with us at prevalence levels that are low enough that we stop wearing our masks. I hope that's the case. I hope that's the case fairly soon. Within the next few months that we're in that mode. It's. I think it's also what I mentioned earlier, that everything here is kind of contingent. So we all hope that this situation improves. We all hope that there aren't more nasty variants that require us to go back to the kind of measures we had in place last year. So in the meantime, it just seems reasonable to wear masks as a general protection. As just anecdotally, I think it's been very nice to not have the kind of colds and sniffles that we usually have, which in the last year, certainly speaking for myself, and I've heard lots of people say this, they didn't get those kinds of bugs that we get in an ordinary year. Do you want to wear a mask to avoid getting the common cold and common viruses going forward? Probably not. But in the meantime, while we're settling back into this new normal, it seems to me like a perfectly reasonable move to require masks. Another thing to bear in mind is, we are a fully vaccinated community, here at Northeastern, but not out there in the world. Alas, we are nowhere near complete vaccination, and COVID in an unvaccinated person is an entirely different story, and it's still an extremely undesirable and dangerous thing. So masks offer a level of protection that is it just seems like a common sense move at this point for all of us to keep our masks on for a while.
Right. There's kind of a responsibility there, isn't there? So, that raises this question of context. We may be a fully vaccinated community here on the Boston campus, but we are surrounded by the city. How does having that urban campus enmeshed in the city around us affect how we relate to the pandemic as a community?
That's a great question. I mean, last year, one of the things that we learned is, we are Boston, and what goes on in Boston, I've just been talking about our community as if this were a community within four walls, which of course it absolutely isn't. Yes, sure, some of our students live with us here on campus, but many of our community members, students certainly, live off campus, and staff and faculty are living off campus. We are Boston. We are whatever is going on in Boston is what's going on in our community. We certainly have to think in terms of we need to think about the Boston community writ large. The community, I shouldn't just say the Boston community, the communities in which we are operating our various campuses around the country, and in Canada and the UK. We are embedded in those communities, and what goes on in those communities is what goes on in our community. Hence, requiring vaccination in our community is helpful in our larger communities. The testing is useful in terms of there is not surveillance testing going on in Boston or in our surrounding communities. The surveillance testing we are doing provides very valuable information to Boston and to the cities in which we're operating. So, masking protects the fact that we're masked and the city is masked protects the people around us. So we're tightly interconnected with our communities.
Right, right. So one thing you were talking about earlier was this decoupling that we're seeing in the data from Israel between cases rising and hospitalizations and death not. So, I think a good place to kind of, I'm looking at the time, recognizing that this may need to be the final question, to kind of think about is looking forward to the future. What do you see kind of in the data happening going forward? And what are the kind of possible futures of this pandemic?
Well, I don't have a crystal ball, but there's some evidence that Delta has peaked and will decline. There could be future waves of Delta. There's some evidence of a 2-month cycle. And it's been about 2 months since the beginning of the if you will, the Delta epidemic. It could be that there are future waves of Delta. The big unknown, and if that's the case, I think we're the vaccines are holding up extremely well, against Delta. I think we will continue as we are. The big unknown is future variants, and the more we can reduce the prevalence of the virus in our society, the less chance there is for a future variant to emerge. But that's the big unknown, and that's what we will be, totally focused on in the coming months.
Right, right. And what's the best way to do that?
Data. We're hence the surveillance testing is extraordinarily valuable in terms of understanding what's going on, and knowing what variants are out there is crucial to taking the appropriate decisions and actions with respect to those variants.
All right. Well, thank you. We do have one question that I can address coming in from Facebook from Sandra. Sandra asks, will the testing dashboard be live again soon? And yes, it will. We will be launching a revised version on Monday as regular testing resumes. So I hope that helps, Sandra. Well, so that's all the time we have for today. For viewers, you can find more information about our COVID-19 wellness initiative at news.northeastern.edu/coronavirus. Thank you so much for your time today, David. We really appreciate it.
It's a pleasure. Have a great semester.